Cross-culturally, I've lived in 4 countries and worked there, and have worked in probably about 15 more. The countries I've lived in are the Seychelles Islands, in India, Pakistan and the Philippines, working on communication or health communication projects in various ways. We've had projects that I've consulted with in Mongolia, Nepal, Bangladesh, Kyrgyzstan, Kenya, in Indonesia, and quite a few other places as well. But the experience of all of those places is that in one sense people are very different, but in many senses people are all the same. And it's been helpful for me to be able to identify a kind of a grid that enables me to move into a cross-cultural situation and begin to analyse that culture and what's going on from that same grid. You come up with different answers, but you can ask the same questions, and that can be very helpful. It's a different situation working cross-culturally with Aboriginal people here in Australia, because there's a sense in which, because they are in my own country, you almost expect them to behave the way that you do, and to be working with a group of people who are quite different, but within a dominant paradigm, is really quite interesting. Whereas when you're working cross-culturally overseas, generally speaking, you're dealing with people who are quite the same as the dominant culture around them. So Australia has presented its own unique challenges in the work that we do, working with Aboriginal people and the way they think, their worldview, their basic assumptions and values and so on. And we're still learning, as is all of Australia really, learning in how to appreciate and take the strengths of Aboriginal culture and to be working with Aboriginal people in trying to improve their quality of life, and to try and restore some of the degradation that's happened because of some of the injustices of the past. For anybody who wants to work cross-culturally, my suggestion is that you start by doing a lot of reading about different cultures, study a bit of anthropology, ethnography, cross-cultural communication, those sorts of things, to give you an understanding of how differently people approach health and disease and wellness, and then to be involved with groups that give you cross-cultural experiences. So become involved with an Aboriginal community in some way, or some ethnic group in Australia, or become close friends with somebody from a different culture here in Australia. And then when you travel, try to lock in with a particular group in a place. Don't just visit as a tourist, but try and go to a place where you can spend a few weeks, if not months, to be embedded in the culture for a little while and really get to understand the frustrations as well as the joys of working in that particular culture.
Okay, so obviously being placed in Broome, my job was to come up with a bloodborne virus program focusing on the young people. And I have a very vivid memory of one of the first sessions I ran at the Youth Drop-In Centre. And it was actually my supervisor, the viral hepatitis nurse, came with me, and she was standing at the back when I ran this session. I had, the fancy PowerPoint, we love our PowerPoints, fancy PowerPoints with all these lovely health messages and then in there about bloodborne viruses. And the kids ran riot for the session, and I couldn't control them, whatsoever. It was really hilarious. We left at the end of the day, and actually the next morning, the director of Kimberley Population Health Unit goes, "I heard what happened yesterday." I went, "Yep, I think I need to rethink my approach." But because of that experience, I then went back and went, right, I'm not targeting, you know, I need to make this more visual, more interactive than what it is. So I actually went back, rejigged it, and then when I went to the youth centre the following week, it actually worked really well. I showed them what a plastic bag was, what a razor was, and actually sat down with them and got them a bit more hands-on, especially when you working with the Aboriginal community as well. They're very visual and very hands-on, so that was quite important. But that was sort of an experience you're either going to cry or you go suck it up and you actually change your approach. So that was quite a turnaround, especially, you know, coming through university thinking, you know, I know my stuff and I know it quite well, but to have that experience thinking, changing that shift in thinking. And I think also challenges working with the Aboriginal community as well. We're not having that previous interaction and just becoming more culturally aware as well, because I also did the Condom Tree program in Broome, and that was quite interesting because they're placed in trees where the local Aboriginal people would gather. So it was just being mindful, if they don't make eye contact with you, it's okay. It's actually part of their culture. So just having that awareness. So there were a couple of challenges, I think, in regards to my first job.
Well, just to give you a bit of a background about the roles that I have had, when I first studied, I studied human movement and health sciences, and then I went on to focus more on health promotion because I wanted to look at the health aspect to the physical person, and I wanted to work with groups of people in the community. So my first role, as soon as I finished university, was working as a diabetes project officer, and in that role it was my job to work with women who have had children but have had diabetes in their pregnancy. So this required me to go and work with lots of different groups, but one of the more challenging groups I worked with were Indigenous mums, and predominantly in the East Metro part of Perth, so there's a metropolitan based Indigenous groups. So I found that quite challenging because I wanted to go and talk to these mums about the need to really look after their diet and be physically active. But that wasn't really always the most interesting topic to talk to them about. They really didn't want me to stand in front of a group and talk to them about how important it was to eat lots of fruit and vegetables and go for a walk. So I had to be really creative about finding what was really interesting for those mums. And so one thing I did do was I worked really closely with some Aboriginal health workers and child health nurses, and I linked in with some of the programs that they were already doing so that I wasn't starting something new. So I started just to spend some time at a child health clinic in Bentley. I spent a lot of time sitting in the waiting room, talking to mums, and sort of sitting around and meeting the types of people that went into those clinics, which probably sounds like a bit of a waste of time to some people, but I did get to meet some people and I got a feel for what mums really wanted in terms of information about their own health. Then I linked into some of their existing programs, and one of them was a mother's group they had regularly. I decided to come along and do some foot pampering for these mums, and it was an Indigenous mums group. So a lot of people came in the day that I was there because they wanted to get their feet massaged and be pampered a little bit too, which is nice. But while I was there was probably about 15 to 20 mums there. I taught them how to do a foot massage because I'm a reflexologist as well. And then they sort of opened up and they allowed me to talk about a whole range of different things. They wanted to know a bit more about how to care for their feet. And we talked about physical activity and also the importance of diet. So I used that as a way in to getting to know people to start with, and also made it interesting and fun. So we did some foot pampering, but we also talked a lot about health, and that to me I thought was really valuable. Another experience of working cross-culturally is I was very lucky to work as a volunteer with a group of other health professionals and travelled to Burma and worked with the local community there in a rural setting. We developed a health education video for a small community in Burma, and that was challenging because obviously they spoke a different language, so we used translators a lot to find out about what the health needs were of the community. We went there and said, how can we help you, basically? There were 6 of us, and we met with a head monk for the community, and he said, can you please develop a video, which we thought was really interesting because lots of people there didn't even have power, but they had a local hospital where they wanted to screen a video for people waiting there for health services in their clinic. So they wanted us to write a video about tuberculosis, the importance of dental hygiene, and also people with eye issues, predominantly glaucoma. So to do that, we used interpreters, and this was a great way of communicating with the community. But also we needed to be very aware of our dress. In Burma, it's preferred that women cover their arms and cover your legs, and so we had to dress appropriately as well. Also, when we spoke with cultural leaders, it was considered respectful when speaking to a monk to hide your feet when seated and face them. And also to cough in their presence was considered to be quite rude. So we needed to be just have an awareness of those issues as well. So from that perspective, we learnt more from the people in this community, I think, than they learnt from us. It was so valuable, but we just had to be aware before we even got there about some of the small things you need to know about when you go into a new community. Well, my first words of advice are don't be scared, because it can be really challenging. Being in a new role in any workplace is really hard. Getting to know people is the first thing, and also you want to put your best foot forward and you don't want to make any mistakes. But I think it's okay to make mistakes because you learn from those. So don't ever be too scared to extend yourself, because at the end of the day, if you do make a mistake, you're going to learn from that. And other people around you may even learn from that too. Also, if you're going to work in a community, try and focus on something that you're passionate about, because you'll get a lot out of it. You may be able to steer your role into an area that you have a passion for or that you want to learn more about. So I'd advise you to look for roles that you're in areas that you want to work. So you may want to work rurally. I warmly recommend applying for jobs in rural areas as well, because culture can be different in different settings, and so working in a rural town as well can also be quite inspiring, because I come from a rural town and I see many benefits of working regionally to become part of a community as well. So if you're thinking of working even internationally, perhaps even try working locally in a rural setting, just to give you a bit of a taste for what it's like to be outside a major city. That would help as well.